Hey, thanks so much for helping me study and practice for our practical exams. I'm like struggling this semester, I swear. Med school is tough, and my ADHD is not doing me any favors, so I really appreciate you letting me practice my clinical skills on you. We were doing a cranial nerve exam today, right? That was the assignment. Oh, I remember that one. All right, cool. Got my notebook, and I do have your notes that I borrowed a couple weeks ago. I'm really sorry I forgot to bring those back. But hey, I left them on my counter so that I'd see it and I'd remember, and I did. So thank you for that tip, by the way. I really appreciate that. I forgot my med kit at home. A couple of things, but yeah, definitely missing a few things. We might have to improvise. Is that all right? You know, good practice maybe for if we ever have to do field medicine. Yeah, okay. All right, let me just take a look at my notes real quick just to give the old brain a refresher. Where did I put my notes? This is not my notebook from that class. In fact, this is not my notebook at all. Well, we're just off to a great start today, aren't we? Okay, well, I'm going to do my best to just try to remember this off the top of my head. And, please give me any feedback. I will not let my PDA or RSD get in the way today. This is super important that we got to study. So just any constructive criticism, I'm open to it. But, again, really appreciate you helping me study. So let's do a little practice, I guess. So we'll supposed to start with an introduction to the patient. Hi there, my name's Dr. Mike. I will be doing your cranial nerve exam today. This is going to be an examination of your cranial nerves that includes your sense of sight, taste, touch, and sound. And during this exam, I'm going to have to be touching you at different parts of your face and your neck. If that's all right with you, fantastic. All right, so we're going to begin by doing a general facial exam and a scalp check just to make sure everything's looking good and that we don't have any problems or anything like a open wound or a sore or what was that? Gloves or hand sanitizer. You're right. Do have some hand sanitizer. See? Need to get some of this. So just gonna sanitize my hands real quick so that everything is sterile and clean. Sterile and clean. Great. Alright, just wanna dry those fingers off. That alcohol smell could be a little strong. Okay, so we're gonna start with a basic face and scalp exam on you. And I'm gonna get up and I'm gonna come real close and examine your scalp real quick, okay? So just hold still for me. I'm just going to move your hair around a little bit. Just gonna check around the back of your ears. Check on this side, back of your scalp, good. Top of your scalp, good. You have really nice hair, by the way. Sorry, I don't want to be like weird, but it's really nice. Sorry. All right, so let's take a look at your face. Just going to do a visual inspection. Look at you. I know, I'm trying not to make it weird, I promise. Do you mind if I just do a little palpating on your forehead here? Okay, good. Good. Alright, I'm gonna touch your temples. Do me a favor, tell me if it feels the same or different when I press, press, press. Same or different, same, good, and press, press, press. Same or different, same, good. Press, press, press. Same or different, same, good. Okay. And now I'm going to examine your T-zone and your sinuses. I'm just going to gently press down your T-zone like this. You let me know if there's any pain or pressure that feels uncomfortable. Good. I'm going to take my thumbs and I'm going to run them under your eyes like that. Same thing, any pain or uncomfortable pressure, you let me know. Just going to press and rub. Good. And press. Rub. Press and rub. Good. No pain or pressure. Fantastic. Alright, now I'm going to just examine your jaw and lymph nodes. So just lift your chin for me a little bit. I'm just going to feel around down here, feel for those lymph nodes. Even though I don't really remember what I'm looking for with the lymph nodes aside from a little swelling, but I'm not really sure what a real lymph node feels like, natural versus swollen, because I forgot from our last inpatient clinical. So we're just gonna say that's normal, right? Cool. All right, so looks like that's all good. Was there anything else I had to do? Anything else I had to do? Anything else I had to do? Muscular test. Yes. Okay. So I'd like you to look straight at me. I'm gonna take my hand and I'm gonna place it on the side of your face. I'm gonna try to press your face to one side. I'd like you to resist. Okay. All right. So here we go. I'm going to place my hand on the side of your face and press, press, press. Good. And one more time. Resist. Press, press, press. Awesome. And we're gonna do the same thing on the other side. Put my hand there and press, press, press. Good. And one more time. Resist. Press, press, press. Awesome. Great job. So everything looks good there. We're going to move on to your sense of a smell now. And I'm trying to remember what the book said. Okay. If you don't mind, have you had any changes in your sense of smell in the last month or week or 48 hours? No? Okay, good. So I want you to just take your finger and occlude a nostril for me. Great. Okay. Looks like we got it. All right, this should work for a smell test. I know we're improving today, but just keep those eyes closed for me and take a whiff of this. And what do you smell? Eucalyptus. Well, that was spot on. You can go ahead and open your eyes. Oh, it's your essential oil. I know. Sorry. Sorry, my brain just, I know it's late and, my medication kind of wore off a few hours ago, so kind of in my, brain's getting a little inattentive, mind's getting a little hyper, that kind of thing happens. So, but yeah, let's keep going. So your sense of smell is good. And have you any changes to your sense of taste? Okay, good. Let's see if I have anything. Do not really. So we're just going to call that good. I think I remember the book said that if a patient doesn't report any changes, it's not usually necessary to test. So, let's just call that good for day. All right. So next we're going to move on to your sense of hearing. So I'd like you to tell me if you've had any hearing loss in the last week. Okay. Any changes to your hearing? Any sounds that have been louder than usual or quieter than usual? Okay, good. And have you noticed any increased sensitivity to sounds or your reaction to them? Okay, cool. So I'm going to use my otoscope, which I did remember to bring, and my ophthalmoscope attachment. Look at me. I remembered a few things. That was great. Didn't remember the bag they come in, but I remembered to put them in my backpack. So let me just pop that otoscope head on, and I'm going to ask you to just relax and close your eyes, and I'm going to inspect your ear. I'm just going to come over here and I'm going to take a look inside your ear. Okay, hey, look at that. It's pretty clean. And tympanic membrane is intact and pearly white. Good. I'm just going to look on the other side. Same thing. I'm just going to take a look inside. Take a look inside. Okay, looks good over here as well. Alright, nice. So the inside of your ears look great. We're going to do some hearing tests on you now. For the first one, I'm just going to ask you to close your eyes for me. And I'm going to make a noise in one of your ears, and I want you to tell me which ear you hear it in, okay? Okay, close those eyes, and good. Both, right? Good. Great. Alright, so I want you to keep those eyes closed. And now I'm going to whisper a word in your ear, and I want you to repeat it back to me. Alright. School. Good. Vacation. Good. Pizza. Alright. And professor. Alright. So your ears are good, and I think that our textbook said that you're supposed to use a tuning fork too. I think it's called the Weber-Rhine test, but I forgot mine. So we're just going to say that your hearing is good for now. Actually, let's do one more hearing test then. I'm not really sure if it's a legit one, but should give us an accurate representation if you can track sounds at least. Okay, so what I'm going to ask you to do then is I'm going to ask you to close your eyes for me. And kind of like follow the light. I want you to follow the sound with your ears, okay? So just follow the sound. Now keep following this sound. Good. All right, go ahead, open your eyes for me. And that's going to conclude the hearing portion of the cranial nerve exam today. And now we're going to move on to the eye exam. So we're going to begin the eye exam portion with a little questionnaire. Have you had any issues with your eyes in the last couple of months? Okay. Noticed any issues with your night vision? Have colors looked any different to you? All right. Any blurriness, double vision, seeing auras or anything, or like little floaty things in your vision? All right, good. And this should be a fairly simple exam today. So we're going to start with the actual eye exam, where I'm going to take my ophthalmoscope, and I'm going to have to get really close to you, if that's okay. Kind of like forehead to forehead, and I promise that I brushed my teeth and my breath doesn't stink. So just go ahead and look straight at me, keep that eye open, and you use your eye. Okay, yep. And all right, just Hold still and look straight. Alright, and I'm looking for like any copper wiring of the ocular nerve near, but I'm not seeing any. That's just good, and everything looks good and intact. Can you look up for me? And down. And to the left, please. And to the right. Awesome. Alright, to the other eye, same thing. Just look straight ahead. And good. Look up. And down. And left. And right for me. Great. Alright. Everything looks good there. So we're going to do a few eye tests just to make sure that all is in good working order. So the first one is very, very simple. Just want you to look straight at my nose. Alright. Straight at my nose. That's where you're going to focus right now. And I just want you to not get distracted by my fingers. Just do not let your eyes distract my fingers. Just look straight at my nose. Straight at my nose. Straight at my nose. Good. Rock solid concentration. That's what we like to see. Alright. Did remember my pen light, which is great. So we're going to do the same thing. Look straight at my nose. And this is just to make sure that your eyes don't react in any kind of abnormal way. Good. Good. Okay. Alright, so now we're going to do test with the ocular occluder. So this is the swinging light test where I'm going to just place this over your eye like this. I'm going to take my light and I'm going to swing it in and I'm going to swing it out. I'm going to swing it in and then out, in, out, just like that, just like I just did. So check your pupillary response, which was perfect. Same thing over here, in and out, in, out, in, out, in, and out. Great. Pupillary response was fantastic. No issues to be found. So we're going to do a few more tests where I'd like you to just look straight at me. And this time I'd want you to follow the light with both eyes. Both eyes. Good. 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 Just keep following the light. I'm trying not to do it myself. So easy for me to get distracted when it's this late at night, but again, I really appreciate you helping me to practice. Okay, so what else can we do? I'm trying to remember, sorry. As I said, that whole ADHD brain really gets you sometime. Oh, we have to do a peripheral vision test. Yeah, that's right. These are pretty easy though. So, what I'd like you to do, again, straight at me. See my fingers here like this? I'm going to go like this, and then like that, and then back in like this, and then out like that, and then again like this. And you tell me when they go out of your vision, and then come back in, and then go out, and then come back in. Alright, so, ready? Straight at me. And here we go, and good job. Good. Good. Great. So we can trick you. Probably not. Good. Good. Great job. And that'll conclude the eye exam portion of today's cranial nerve exam. We have one more portion of this exam, which is the sensation test. So for this, I'm going to be using some objects to touch you on different points of your face and neck, and you're going to help me identify that object, okay? So let me just see what we have here to use today, okay? All right. So I found a lightsaber chopstick in my backpack, and I found this makeup brush on the table. That, if it's okay with you, we can use this. All right. So for the sensory portion of the exam, I'm going to ask you to close your eyes for me, and I'm going to touch you with either the chopstick, which is going to be called dull, or I'm going to touch you with the brush, which will be soft. All right. So you let me know which one you can feel. So just close your eyes and touch. Dull, very good. And soft again. Dull, soft, dull, soft, dull, soft. Okay, you can open your eyes now. And that will conclude today's cranial nerve exam. I did not find anything wrong with you, and I'd say that all of your cranial nerves are intact and you are in perfect health. So if you need anything, you can always call the office or schedule another appointment. All right, I think that was it, right? Any feedback? Yeah, I thought I missed a few things, like not taking any patient notes during the exam. Oh boy. Well, guess I'll have to try to remember that, but thank you so much for helping me. As I said, I can always use the practice, and you have been such a great partner. I definitely owe you a coffee or dinner or both if you like, but I guess I gotta get out of here. It's late. It's always good to see you and hang out with you. As I said, dinner, coffee, I owe you. So just let me know, and I guess I'll see you in class. All right, I'm gonna get out of here. I'll see you soon. Bye.